We're at the IAS meeting in Amsterdam. We're here with Jean-Michel Molina, who is with ANRS and also University of Paris. You've had quite a run with the work that was really important in PrEP, and I'm going to let you set us up on that, kind of the story from a historical perspective,
Sure.
Recent historical perspective.
Thank you. So we started to be involved in PrEP in 2012 when we started the IPERGAY study among MSM, and we were willing at that time to assess an on-demand regimen as compared to a daily regimen for PrEP with TDF and FTC. And we have shown at the beginning of 2015 that indeed with PrEP, whether you take it daily or on-demand, you have actually a high efficacy against HIV acquisition. In the early stage of the study, we have shown an 86% reduction in the risk of HIV incidence with oral PrEP taken on demand. And in the follow-up open label phase of the study, this high level of efficacy even raised to 97%. So these are data from clinical trials, and what we are willing to do now is to implement PrEP among high-risk individuals in France, mainly gay men. And we have started with the support of the ANRS a new project called Prevenir, meaning prevent in France, to again upscale PrEP implementation in France, mostly in the Paris region where you had the highest prevalence of HIV, and also to see and to measure the impact of PrEP implementation on the HIV epidemic. Could we, with PrEP, combined with upscaling testing, early treatment of HIV, promoting still the use of condoms, can we contain the HIV epidemic and see a decline in the number of new infections nationwide? And at this conference, actually, we have presented interim report of this new study on the first 1,600 people enrolled in the study. Half actually chose to use PrEP daily, half on demand, like it is recommended by European guidelines, but also now Australian, Canadian guidelines. And we've seen with either dosing regimen, no breakthrough HIV infection. So a very high efficacy in real-world implementation of PrEP, which is very reassuring. We still have to be careful. Of course, zero doesn't mean that this is 100% effective, but that it is very highly effective if people take it as recommended. Recently, the IAS USA guidelines on PrEP also endorsed the on-demand regimen. So I think we have more and more guidelines and countries that are proposing both daily and on-demand oral PrEP. The idea is to increase the options for people willing to take PrEP. So those who are not willing to commit to a daily regimen could use...
And who don't really need it daily, who have seasons of sexual encounters and...
Potentially. So, the frontier between daily and on-demand is not that huge. It's just, to make it PrEP more friendly, user-friendly, I would say, and so that people would not be concerned about a non-daily use of PrEP as long as they follow the dosing regimen that we recommend in the on-demand dosing. So I think we've seen at the conference also WHO pushing many countries now to implement PrEP, and they are providing new tools for facilitating implementation of PrEP in many countries. I think it's nearly 50 countries now that have PrEP programs ongoing, and so that's really nice to see that this is a field that is moving forward, and we hope that it will help also to control the epidemic, because the epidemic is not yet controlled, as we know, and for these countries, the cost of lifetime treatment for those infected is very high. So prevention is key, and we do need to strengthen prevention again. We have condoms, we have male circumcision, and now we have PrEP, and we should use every tool we have to do better in prevention.
Can you kind of give me a background on kind of way back when you thought about this? Was this your idea? Were there people that came to you and said, we don't need to use this every day?
Well, I guess, we were discussing with our colleagues using or starting to assessed daily PrEP in their program. So that's nice that we were able to communicate with our US colleagues or colleagues in Africa and in other places. We also had a lot of interactions with our colleagues at CDC doing macaque models. And it's actually following these discussions that we felt that daily would be fine as a first proof of concept, as a first step, but it may not fill everyone's need also. And we thought that adherence is a key issue with daily PrEP. We thought maybe with an other strategy on demand, it would be potentially easier for people to adhere to this regimen, and therefore we might see a better efficacy. And we discussed with the colleagues doing macaque model, and we thought that's the dosing regimen we should try to use in humans. And it worked beautifully, and actually the best efficacy results in PrEP trials come from the on-demand PrEP studies up to now, with similar results at the same time in the PRAD trial using daily PrEP. So that was very reassuring to see that with both regimen, as long as you take it as recommended,
right. And that's the key. I think everyone should know this is serious stuff, that they are going to be taking a drug to prevent, not treat, but prevent the disease. So
you're very correct. And it's like condoms. They work if you use it. PrEP works if you take it.
Right.
So don't expect the drug to work.
And the same thing with the treatment.
Exactly.
If you don't take the treatment, it doesn't work either. So it's important for people to know that they need to pay attention to the directions and the recommendations on this for sure.
And I would, on the top of that, if you want to stop using condoms or PrEP or any preventive tool, you want to make sure that your partner is HIV negative.
Right.
Because that's key. We've seen a couple of people stopping PrEP because they felt they were no longer at risk.
Right.
Because maybe the partners, they were in a stable couple now. So before doing that, make sure that your partner or your partners are HIV negative, because that would be a shame, to be infected if you stop using these tools.
Or on treatment.
Or on treatment with an detectable viral load, of course. In that case, you don't need PrEP.
Right.
If your partner is HIV positive on treatment with an undetectable viral load, this has been confirmed again at this conference with the data from the Partners 2 study, there is no risk of transmission. Right. So in that case, no need for PrEP, no need for condoms.
So education is key here, and we've done that. So we really appreciate you taking the time to do that.
You're very welcome. Thank you.
Thank you, Jean-Michel.